Good day, everyone. I am Addy Nicole Cadungog, 3AB Psychology A, and I will be the first to report about modern perspective on abnormality. For our topic outline, we will going to talk about modern perspective on abnormalities, which under the modern perspective on abnormalities, the beginning of modern biological perspective. And in the beginning of modern biological perspective, we will going to talk about the general paralysis and syphilis. For our intended learning outcomes, it is to know the progress of scientific study in understanding of normal behaviors. Second is to understand paralysis and syphilis and acknowledge the people involved in the cure of paralysis. Now, the modern perspective on abnormalities. Although the treatment of people who exhibited abnormal behaviors deteriorated somewhat on the turn of 20th century, tremendous advances in the scientific study of disorders took place in the early 20th century. These advances laid the groundwork for the biological, psychological, and social theories of abnormality that now dominate psychology and psychiatry. These advances help usher in what we know today as the scientific or experimentally oriented view of abnormal behavior and the application of scientific knowledge to the treatment of disturbed individuals. So we have emerged from animism to now using the empirical or experimental knowledge in treating abnormalities. Now to the beginning of modern biological perspective, we should first define what is biological perspective. It is a field of psychology which is often referred to as biopsychology or biopsychological psychology. It focuses on the nervous system. The topics of the biological perspective focuses on nervous system, hormones and genetics, and the relationship between mind and the body. The neural mechanism and the influence of hereditary on the behavior. So advances in the study of biological and anatomic factors as underlying both physical and mental disorder developed in this period, in the beginning of modern biological perspective. So one of the most important discoveries underpinning modern biological theories of abnormality was the discovery of the cause of general paralysis, a disease that leads to paralysis, insanity, and eventually death, according to Duffy 1995. My group mates later will going to introduce to you two important person in the beginning of modern biological perspective. They contributed a lot in this era, and we will going to or they will going to tackle that for you later. Now, let us understand general paralysis and syphilis and how these two diseases are actually connected. So it could be traced back in 1825 when a search for a cure in general paralysis began, when French physician A.L.J. Bailey differentiated general paralysis or paralysis as a specific type of mental disorder. Bailey gave a complete and accurate description of the symptoms patterns of paralysis. So in the mid 1800s, report that patients with paralysis also had a history of syphilis lead to the suspicion that syphilis might be a cause of paralysis. Now let us go back, or let us look on 1897 when Viennese psychiatrist Richard von Krafft-Ebing conducted experiment involving the inoculation of paralytic patients with matter from syphilitic source. So what is this? We are always mentioning syphilis, and we do not know what is syphilis. So let us define what is syphilis. It is a bacterial infection usually spread by sexual contact. The disease starts as a painless sore, typically on the genitals, rectum, or the mouth. The syphilis spreads from person to person via skin or mucous membrane contact with these sores. So in the back to the experiment of Kraft-Ebing, none of the patients developed syphilis. And Kraft-Ebing concluded that they must have already infected with syphilis. So they discovered that syphilis is the cause of one form of insanity lent great weight to the idea that um, biological factor can cause abnormal behavior. Now, on 1906, August von Wassermann created a syphilis blood test, and this advancement made it feasible to screen for the presence of the dangerous bacteria or the syphilis bacteria in the person's bloodstream before the infection's most serious symptoms appeared because we have Kraft-Ebing actually discovered that the syphilis and the paresis or the general paresis are connected, and when there is syphilis, there might be a greater chance of um, general paresis, which could lead to death. Now, in 1917, Julius von Wagner Jauregg, director of the University of Vienna Psychiatric Clinic, finally developed the malaria fever treatment for syphilis and paresis in 1917. Since he was aware, or Julius von was aware that the high fever that associated with malaria clear off the bacteria of syphilis. So 3 of the 9 paretic patients he infected with the blood of a soldier who had malaria showed a considerable improvement in their paretic symptoms, while the other 3 showed signs of recovery. So this malaria fever treatment by Julius von is actually a great success in the field of biological perspective. Around 1905, when several hospitals in the United States were providing their patients with the new malaria treatment for paresis. Of course, in the present time, penicillin is an excellent, less complicated therapy for syphilis today. Now, as we go on those timeline, going back in 1825, we have seen how many years, or like 100 century, they have been searching for a cure for this general paresis, and we see improvement on every year, or every year that was tackled. And now we have this penicillin. It is an excellent, less complicated than what the malaria treatment. And we should acknowledge those people who shows the dedication on finding cure on this disease. It was established in the modern period that general paresis is a kind of neurosyphilis. So what is this neurosyphilis? As mentioned here, neurosyphilis is a bacterial infection of the brain or spinal cord. It usually occurs in people who had an untreated syphilis for many years. So the discovery of Viennese psychiatrist Richard von Kraft-Ebing is actually true up to this day. So for our summary, during the 20th century, an advancement in scientific study took place and it centers on understanding abnormal behaviors. So paresis was discovered to be caused by syphilis, which were left untreated for a long time. A blood test on syphilis was made in 1906. Malaria fever treatment on syphilis and paresis in 1917 was made, and in 1925, U.S. hospitals used malaria treatment for paresis. And today, penicillin became the modern treatment for syphilis. Now, this is my references, and I hope that you have learned about my report. Thank you very much. God bless us all.